in the middle of your Easter weekend, which makes this Easter Saturday. And it's time for 15 diabetic friendly minutes on VOB, compliments the Barbados Diabetes Foundation. And what Easter topics is we dealing with today?
So if you're preparing fish this Easter, the good thing is that fish is a protein.
Nutritionist Victoria tells you how to prepare fish for Easter.
That's good, cause you're doing fish tomorrow.
We hear another What's in My Lunch Bag segment with Chinwe.
Who's Chinwe?
You're Norway, listen.
Peripheral arterial disease to be diagnosed, honestly, it probably comes first from yourself.
Dr. Nina Yap on how peripheral arterial disease can be diagnosed. And our song today has something good in it that you will want to hear, so stay tuned. All sponsored by the Maria Holder Diabetes Center, the Barbados Diabetic Ice Screening Program, and the bank that's the one for you, Republic Bank.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
If you are diabetic or pre-diabetic and you need diabetic services, but you need to make your dollar stretch no further than the Maria Holder Diabetes Center. For vascular, podiatry and diabetic eye screening services or consultations with diabetes doctors and nurses, call 417-0305 today. The Maria Holder Diabetes Center, located in Warren St. Michael. They can save your life and save you money, but members get 10% off.
A good Easter Saturday morning to all the people listening to VOB right now. This is Peter Boyce here. I hope you've been enjoying your Easter weekend. Did you fly any kites this weekend? Remember not to fly close to the airport. And also, if you are diabetic or pre-diabetic, remember this segment every Saturday on VOB, telling you all about the excellent services that can be found at the Maria Holder Diabetes Center, an institution dedicated exclusively, that means specially for you, to the management of diabetes in Barbados, offering a multidisciplinary approach to diabetes care, where patients can be seen by diabetes specialist physicians like Dr. Diane Brathwaite. Morning, Dr. Diane. Specialist nurses like Nurse Tracy, nutritionists like Victoria Cox, and podiatrist Louise Robinson. You can also get your ice cream for diabetic retinopathy, which if you are diabetic, you have to do that every year. That department headed by Dr. Charles Pierce. So you don't have to drive all over the place spending a lot of unnecessary gas money. You can just go to the Maria Holder Diabetes Center, located in Warren St. Michael, right behind Eunice Gibson Polyclinic. Get all your diabetic services at one place at a reasonable location. I know you're hearing about how tariffs might carry up prices, so it's even more important for you to spend your money carefully, and you also get a bar discount as well.
The Maria Holder Diabetes Center.
Hello, Alfonso here. In this segment, I will be going to an employee of the Maria Holder Diabetes Center and doing a spot check to see what they have in their lunch box, to see if I can find anybody with conquerors or macaroni pie, or if they are practicing what the Diabetes Center preaches and eating healthy foods, so I can see if I can get somebody. The person that we are going to today is Chinwe. Let me see how that goes.
My name is Chinwe. I am a medical receptionist here at the Maria Holder Diabetes Center for the Caribbean.
Hi, Chinwe.
And today I'm going to show you what I have for lunch. In my lunch bag, sorry.
Yeah, I'm ready to see.
So first of all, I have some fruit. Usually I will just eat this as a little, either a mid-morning pickup snack or like a late evening snack after my lunch.
So let's see here. Chinwe got some diced up orange, and also some apple and grapes mixed up in there. That sounds good. So you don't see anything else with this?
Sometimes I'll pair it with granola or yogurt, but today I have a heavier lunch, so I just have the fruit today. So now to the main part. I have This is my lunch. Okay, so today I have some stewed chicken with some brown rice and vegetables.
So that is stewed chicken, that's protein, and then you got veggies, carrots and broccoli, and you got brown rice, that is good fiber. Very good. So what are you drinking with this, Sylvia?
For a drink, I have my 40-ounce cup of water, because I don't really drink like soft drinks or juices. I usually just consume water.
You can't go wrong with water. So that's all?
So that is all I have today. It was not much, but yeah, thank you.
You're welcome. So when out there listening to VOB, when I hear that, Sylvia has a proper lunch. What about you? Do you really need to eat that put in a sauce order today? Eat a proper healthy meal instead, so you can avoid all the ACDs that is here about all over the place and put some proper food in your stomach. It was Good Friday yesterday, and I know a lot of people will be eating fish, and some people might be taking eating fish again tomorrow for Easter Sunday. So this is Registered Dietitian with Maria Holder Diabetes Center, Miss Victoria Cox, to give some tips on prepared fish.
So if you're preparing fish this Easter, the good thing is that fish is a protein, so it's not going to acutely affect your blood sugar in any way, but of course you still want to keep it nice and healthy, so avoid deep frying if possible. Try to steam your fish or grill your fish or bake your fish, so just using less oils and butters in the preparation method, as well as try and go heavy with fresh or dried herbs and spices instead of using particularly salty or high sodium seasonings or seasoning packets. And then from a blood sugar perspective, keep track of your portions of whatever starchy foods you may choose to serve with your fish. Always include your vegetables and of course drink your water.
Thank you, Victoria. Next we are going on to PAD, Peripheral Arterial Disease. How do you know that you have it? How can it be diagnosed? We go to diabetes vascular specialist Dr. Nina Yap to answer that question.
So, peripheral arterial disease to be diagnosed, honestly, it probably comes first from yourselves, the patient. When you go to your general doctor at the polyclinic or at their office, and the question that they should be asking, especially in a person that's a diabetic and has high cholesterol, is how is your legs? How is your feet? If you had to walk from one bus stop to another bus stop, how is it? And to be honest, most GPs may not ask it, but most patients, when they sit down and the doctor says, anything troubling you? They'll say, my legs are feeling heavier. I used to be able to walk around the garrison, let's say, with no problem, and now I realize I can only do half, and I have to sit down, and when I sit down, the pain goes away, and I do the next half of the garrison. PAD mostly is diagnosed probably coming from the patient with subtle signs. What they will say is that their legs are slowly tiring. Now, let me say that there are many reasons that your legs can be slowly tiring. You can have maybe back pain, or joint pains in the knee, or pains in the ankle, or leg swelling from heart issues. So there are myriad of reasons that your legs could tire. But if you realize at the same distance you walk every day, so let's say from the QEH to St. Michael's, and you have to sit down there and restart again, having the same distance pain come on at your legs and it gets better with rest, that is almost certainly something called claudication. And again, that's just a medical word for pain on exercise at a certain distance. Now, after that, is that enough to say that you have PAD? Not really. The real next best thing is to get some tests done, which are almost blood pressure tests of the legs, to see how much blood pressure is actually getting to legs versus the ones on the arms. So all of us go to the doctor, we get our blood pressure done on our arms. If you think, or if you and your doctor come to the conclusion that you might have peripheral arterial disease or circulation issues, the next best thing after them taking your history to make sure there's nothing else in there that could account for this, like a back injury, then the right next thing to do is a test where they get the blood pressures done of the arms and compare it to those down by the legs. There are many other sort of more extensive tests and intense tests, but that's probably a good place to start. And also when your doctor is speaking to you in the first visit or whatever visit you're having, when they examine your pulses. Now, the doctor will put their hand on your groin, behind your knee, and on top of your foot. And what they're actually feeling for is to see if they can feel your heartbeat at those points down your leg. Because believe it or not, you can actually feel your heartbeat near your toes. If you have a strong heartbeat down by your toes on both legs, it is unlikely that you have major circulation problems. Not impossible, but very unlikely. So to me, if a doctor in the office examined their patient and they had good pulses down by the foot, it's unlikely that they have significant circulation problems. So diagnosing peripheral arterial disease is actually different in many different countries around the world, but it starts off with an office visit with your doctor, them taking a history from you, examining you, and if they really think it's something to look into, then raise the blood pressure sort of test to the leg.
A brand new service which we can be proud of is now available at the Maria Holder Diabetes Center. Vascular or ABI screening. Who should get a vascular screening? Persons living with diabetes or persons who experience pain or burning sensation in their legs or toes, especially while they are resting. This is normally referred to as bad circulation. Book your vascular or ABI screening test today by calling the Maria Holder Diabetes Center 243-3937 to get more information and make an appointment. Board members get 10% off.
And now we are going into our Saturday Song of the Day. And this is what you'll be saying when you walk through the doors of the Maria Holder Diabetes Center. Something tells me I'm into something good. Title of this song by Herman's Hermits with the compliments of the Maria Holder Diabetes Center and Republic Bank.
Something tells me I'm into something good. Something tells me I'm into something. She's the kind of girl who's not too shy, and I can tell I'm her kind of guy. She bends close to me like I hope she would. She asks me like I hope she would. Something tells me I'm into something good.
The Maria Holder Diabetes Center.
Only dance for a minute or two, then she's stuck close to me the whole night through. Can I be all in love? She's everything I've been dreaming of. I moved her home and she held my hand. I knew it couldn't be just a one night stand, so I asked to see her next week, and she told me I could. I asked to see her and she told me I could. Something tells me I'm into something good. Something tells me I'm into something. Something tells me I'm into something.
The Maria Holder Diabetes Center.
My name's Louise and I'm a podiatrist here at the Barbados Diabetes Foundation. Top tip for today, please examine your feet daily. Things to look out for, cuts and blisters, and maybe you've stood on something and you won't feel it because you've got neuropathy. Look out for swelling, temperature, burning. That could mean an infection. So please, guys, get your friends, your neighbours, your family, just get your feet checked. And if you've got any problems, please come and see a podiatrist. Thanks.
Just about a couple months ago, Diabetes Foundation, they had called me, Dr. Prophet, send the message that they were doing the eye screening program, and I went and I had my eyes done. Both me and my fiance. And I can say that I was well satisfied with the result. Right now the cataract is under control. I would say yes, that is very good. It's very good for diabetic.
In 2025, the Maria Holder Diabetes Center, located in Warren St. Michael, with their diabetic eye screening, vascular screening, and podiatry services, offers a standard of diabetic services that equals or surpasses any you might receive internationally at a price that everyone can afford. So if you are diabetic or pre-diabetic and listening to VOB right now, call and make an appointment to get your eye screened for diabetic retinopathy by calling 243-3937. Or if you are having vascular or circulation issues or need to see a podiatrist or nutritionist, call 417-0305. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program, Republic Bank, and the Maria Holder Diabetes Center. Until next time,
reach for that extra glass of water. That is the smallest thing that you can do to make the biggest impact on your health.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937 to find out how you get your simple digital eye screening done for just $100.
Dream a dream and watch it become a reality. You